How to know if you're dealing with coronavirus or allergies. If you're not sure whether you're dealing with the coronavirus or seasonal allergies, you've come to the right place. For those who deal with seasonal allergies, spring can be really rough all on its own. Sinus pressure, itchy skin, watery eyes, and congestion may not sound so bad to those not initiated into the allergies club, but these symptoms have a way of making life seriously difficult. And this year, with the coronavirus in the mix, spring allergy season is feeling more complicated than ever. Aside from making you feel miserable, seasonal allergies to things like pollen can be particularly confusing this year since many of the symptoms are similar to the symptoms of COVID-19. And with healthcare settings limiting in-person visits to reduce transmission of COVID-19, many people are unsure whether they can even still see a doctor for non-life-threatening symptoms. To lend a hand to all the allergy sufferers among us, we asked experts how you can determine the difference between allergy and coronavirus symptoms, when it's time to consult a doctor, and why it's worth doing that even when you can't physically step into a doctor's office. There can be a lot of overlap in coronavirus and allergy symptoms. Allergies and viral infections can present in similar ways, especially nasal congestion, cough, sinus pressure, fatigue, and achiness. Tina Cinder, MD, allergist with Stanford Health Care and clinical assistant professor at Stanford Medicine, tells Self. These similarities can make it challenging to know exactly what's going on in your body if you start feeling sick while the COVID-19 pandemic is happening. Having a good understanding of coronavirus symptoms and signs of seasonal allergies, also commonly referred to as hay fever or seasonal allergic rhinitis, is a helpful first step. The Centers for Disease Control and Prevention (CDC) lists the following common symptoms for the coronavirus: coughing, shortness of breath or difficulty breathing, fever, chills, potentially including shaking, muscle pain, sore throat, headache, new loss of smell or taste. Meanwhile, these are common seasonal allergy symptoms, according to the Mayo Clinic. Coughing, sneezing, fatigue, a runny or stuffy nose, postnasal drip, red or watery eyes, swollen, discolored under eye skin, itching in your mouth, throat, eyes, or nose. Keep in mind that these aren't all inclusive lists, and you may experience other symptoms with both COVID-19 and seasonal allergies. For example, the more experts learn about the coronavirus, the clearer it becomes that the disease can sometimes cause gastrointestinal symptoms like nausea. But still, it's good to have a solid understanding of the most common symptoms involved with both conditions. Here's how to tell the difference between the coronavirus and allergies. If you have a fever and associated symptoms like chills, this is a big red flag that your symptoms may be associated with COVID-19 or another virus and not seasonal allergies. In response to an infection, your body temperature might increase in an attempt to kill pathogens. A higher temperature may also trigger your immune system to make more white blood cells and antibodies. You should not get a fever with allergies, Dr. Cinder says. If my patients who have allergy symptoms are reporting fever, I'm concerned about an infection. Itchiness is another big differentiating sign between COVID-19 and seasonal allergies. Typically, itchiness and environmental allergies go hand in hand, Dr. Cinder says. This is because, in response to an allergy trigger, your immune system's mast cells release histamine, a chemical that can cause itching along with other allergy symptoms. If you're overwhelmed with an itchy sensation after you, say, go outside to pick up groceries or go outside for a run, that's a sign that you're likely dealing with seasonal allergies. Another tip is to trust your knowledge of your body. If you've had allergies in the past, you'll likely be able to tell if the symptoms you're experiencing now align with the norm for you. If your symptoms are new, different, concerning, or you have any questions, it's a good idea to reach out to a doctor. Of course, there's also the possibility that you're dealing with both allergy symptoms and COVID-19 or another viral illness, like the common cold. If you have an overlap of characteristic symptoms that would normally distinguish these conditions from each other, like a fever, cough, sneezing, red eyes, and nasal itching, unfortunately, that could be what's going on. Here's what to do if you think you're dealing with allergies. Managing seasonal allergy symptoms is no easy feat, especially if your allergies are severe and leave you feeling pretty miserable. One of the best things you can do is minimize your exposure to triggers. When it comes to seasonal allergies, the biggest ones are pollen and outdoor mold spores, according to the American Academy of Allergy, Asthma and Immunology (AAAAI). Now that many of us are spending way more time indoors these days, avoiding these triggers may be somewhat easier than usual, but you probably can't avoid them completely. This is particularly the case if you're an essential worker or if your state is reopening and you're not able to stay home because you need to make a living. Even if you are able to shelter in place, you probably still need to do things that would expose you to these allergens, like go buy food or pick up prescriptions. First things first, when you do need to leave your home, try to reduce how much pollen and mold you bring back in with you. Sarah Sheikh, MD, who is board-certified in allergy, immunology and rheumatology and director of the Clinical Trials Program at the University of North Carolina Thurston Arthritis Research Center at UNC Chapel Hill, suggests removing your shoes when you enter your house to minimize tracking allergens indoors, washing your clothes after you've spent time outdoors, and hopping in the shower before bed so you don't transfer symptom-causing particles to your bedding. She also suggests keeping your home and car windows closed. Any breeze in an open window will bring in the unwanted allergens and can make allergies worse, she says. Beyond that, make sure you're stocked with medication that can be helpful for managing seasonal allergies. Doctors recommend options like over-the-counter long-acting antihistamines, antihistamine nasal sprays, eye drops for itchiness, and steroid nasal sprays. You can also try a nasal rinse, which involves rinsing your nasal passages with distilled saline water to help remove allergens. If you are going down this route, be sure to read product labels carefully and follow directions to make sure you do not accidentally give yourself an infection while doing this. Corinne Happel, MD, an allergist, immunologist and assistant professor at Johns Hopkins School of Medicine, tells Self. If you know what medications work well for your seasonal allergies, Dr. Cinder suggests taking them during your usual allergy season even if you're not experiencing symptoms. Maybe you're fortunate enough to be able to shelter in place so thoroughly that you barely have to leave your home, which is great. But if you would normally be an itchy, sneezy mess right now, you should still follow your usual treatment as a preventive measure. When allergies flare up, it can be difficult to get them under control, which is why allergists are in support of doing what's possible to avoid that altogether. Really what you need to be doing is maximizing treatment so that you're not getting to that flare, Dr. Cinder says. And then having a plan so that when you get to the flare, you know exactly what to do. If you can get a jump on the situation by beginning your medication before the season that really inflames your allergies starts, even better. For patients who know that they have seasonal allergies, being more proactive and getting a head start before their actual pollen season hits often helps control these symptoms and prevents breakthrough symptoms. Christina Cruz, MD, allergist at Tufts Medical Center, tells Self. Controlling your allergies is especially important if you have allergy-induced asthma, since there's a lot of concern around whether people with asthma are at an increased risk of severe COVID-19 symptoms. Here's what to do if you think the coronavirus is causing your symptoms. First, try to get in touch with a doctor or medical professional via a resource like a state-run COVID-19 hotline so you can describe your symptoms and get advice on potential next steps, like testing and treatment. If it turns out you do have the coronavirus, your focus should be on looking after yourself, knowing when to go to the ER or call 911, and reducing the odds that you'll spread the virus to others. Here are some self-stories that can help. Here's what to do if you think you have the coronavirus. Here's when to seek emergency medical care if you have the coronavirus. Can you use ibuprofen to manage coronavirus symptoms? What's the difference between social distancing, quarantine, and isolation? If you're at all unsure or really not feeling good, try to get a telehealth appointment with a doctor. Yes, even if you think it's just allergies ruining your life right now. If you can't seem to get your seasonal allergies under control at home, you should consider talking to an allergist who can help you find a treatment that provides some relief. And if you're not sure whether it's allergies, the coronavirus, or something else entirely that's making you feel terrible, that's also a sign that you should get in touch with a doctor. Seeing a doctor right now can obviously be tricky, given that most physicians are limiting in-person visits to reduce transmission of COVID-19, but this doesn't mean you need to helplessly deal with your symptoms until the threat of the coronavirus is no longer an issue. Fortunately, many allergists are offering telemedicine appointments that allow you to video conference with a doctor from home. Allergists can actually gather a ton of important information from a telemedicine appointment, Dr. Sheikh tells Self. They can look at your eyes and nose for signs of irritation or watery discharge, see how you're breathing, pay attention to coughing or throat clearing, look for signs of congestion, talk with you about your medical history and symptoms, and more. There's a lot of value in telemedicine visits, especially during this time when we all need to stay safe, Dr. Sheikh says. Telemedicine has its limitations here, though. Since many allergens can elicit the same symptoms, a physician may not be able to determine exactly what you're allergic to without seeing you for further testing, such as a skin prick test, where an allergen is inserted into the surface of your skin to see if it causes a reaction. Still, Dr. Sheikh says there is tremendous value in these types of appointments and that they can help set you on the right path until you are able to seek in-person care.